Hi, I'm Geetha. I'm one of the first year GI fellows. I came here from Boston because everyone I met here on my interview day was so welcoming and so happy that this is the place I wanted to be.
Hi, I'm Anna and I'm an endocrine fellow. I chose Children's Colorado because they offered me a great balance of an incredible and supportive work environment with experts in my field, along with plenty of opportunity for fun outside of the hospital.
One of my favorite things about Children's Hospital Colorado is the relaxed atmosphere and the ability, kind of open door policy, to walk in and talk to anyone in the group at any time.
So I actually trained in England before coming here, but I did my residency here. So it's nice to be able to stay here and getting to know all the residents as well.
The faculty here are awesome. I feel like they're my friends and my peers. They just happen to know a little bit more than me, but they're really willing to share and teach and really put us as a priority.
They are amazing mentors, and despite being leaders in their fields, they're super relatable, they're down to earth, and you feel like you're working with a colleague, not working with an intimidating supervisor. So it really makes the experience amazing. You become friends with them, and it makes it a joy to come to work every day.
Interacting with the faculty is fantastic. You're treated more like a peer than you are a resident. You are certainly treated as if you are an active learner in the process, and one that they view as a collaborative as well as contributory physician.
Fortunately, there's a great way to meet a lot of other fellows, and everyone coming here is looking to make friends, whether it's through our longitudinal curriculum, happy hours, or even just doing consults and getting to meet a lot of different fields. I found it was super easy to make new friends.
Something that I really appreciate about being a fellow at Children's is that we have this longitudinal curriculum that covers topics relevant to all fellows, such as scientific writing and mentoring and career development. Plus, it gives us a chance to get together and form friendships with other fellows, even outside of our own department, which is probably the best part.
We have a lot of camaraderie within our own fellowships as well. In mine in particular, we have journal clubs, we have events and physiology sessions where we get together and eat and have beverages at restaurants around town.
Hi, we're the ID team. We love working with the residents here. We have a very relaxed relationship with them. Communication is really open both ways, and we learn a lot from them, and I hope that they learn from us as well.
So being a fellow here at the University of Colorado is a great experience, not only for my training, but for the people that I interact with. I think namely the pediatric residents. The pediatric residency at Children's Hospital Colorado and the University of Colorado just has a tradition of excellence, and as a fellow you really get to see the growth that residents have over the years, and the opportunities to teach and interact with anyone from interns to senior residents is a great way to share your passion for whatever fellowship you're a part of, and to get people excited about the same things you are. There's a lot of opportunities to teach as a fellow. You can teach on the wards or in clinics when you're seeing residents and medical students that we interact with. And also, there's a lot of opportunities through the pediatric residency program, through didactics and conferences that they have. There's just a lot of ways that if you're interested, you can jump right in.
We are so lucky at Children's to have absolutely outstanding fellows. I think it really means a lot to the residents to work with individuals that can really teach them and help support them through really a challenging, residency program. And I think especially overnight, the second years when they're on call, having their fellows to get backup from and get advice from is so critical. I remember many call nights calling the HEMONC fellow, PULM fellows, PICU fellows, everybody. And it's really important to have them to kind of back us up overnight, especially with challenging families or patient situations.
We really think that fellows are part of our program, they're part of our practice, and one of our major goals is to educate fellows to become scientists, practitioners, and advocates in our community.
I would say my experience with the fellows has been uniformly positive, and that's not just because I'm being interviewed by a fellow, but I really feel like the fellows here, first of all, really support residency education, support our autonomy, make sure that every conversation we're having with them is positive and educational. So I've really enjoyed working with all of the fellows, and also they're really fun to collaborate with them. Always happy to have them in our team rooms. They're really approachable, really kind.
So
even
funny.
in the middle of the night, so funny.
Yeah.
And yeah, I have enjoyed working with every fellow across all specialties. So I have only positive experiences.
I think we are used to getting a script kind of and learning certain information, and first year is hard pretty much across the board, but this is completely different and learning how to get into the research world, but it's a good experience.
As someone who didn't really know their research interests coming in, I was a little nervous about research opportunities. I found that there's been a lot of guidance and a lot of opportunities. So I'm personally getting a master's in clinical science. I'm also in a clinical outcomes fellowship with a lot of great mentorship.
You're very involved with individuals all over the state in some research projects, as some all over the country. You can also, as a fellow, elect to be a part of various master programs, masters in clinical science, public health, and other quality improvement initiatives to help further your career and your education while in fellowship.
Working at the University of Colorado is fantastic. We get to serve a very diverse patient population and work with residents, students, faculty, and other co-fellows from various backgrounds. The diversity and experiences and backgrounds our co-fellows bring is what enhances our programs and makes us better physicians. Throughout our fellowship program, there's opportunities to be involved in the Minority and Ally Resident Council that consists of not only residents, but fellows from all different programs to try to enhance the diversity within the workforce and make us better culturally competent physicians.
I'm one of the co-chairs of the Diversity in Pediatrics Committee, also known as DIPSY. We're a resident-led organization that aims to recruit and support diverse residents, as well as foster an inclusive environment in our program and in the hospital. We also provide education to residents, as well as lead community projects and mentorship programs. We're mostly composed of residents, but we also have fellow members and faculty members. We're one big, close family, and we would love it if you could join us. Please email dipsycolorado@gmail.com for more information.
So one of the nice things about being a fellow here is that the university really takes seriously fellow mental health. So for every single fellow in every program, they arrange time off, pay for, and schedule a mental health visit for you. It's opt-out just in case you didn't feel like you needed to use that, but at least that option is there. There's also other opportunities for wellness here at the University of Colorado. So there's a House Staff Appreciation Week, where we get breakfast one of those days. There's also half-day fellowship retreats and conferences where we talk about things specific to fellows. And then every program has their own specific fellowship wellness activities.
My wife and I knew we'd love it here, but I think Denver has even exceeded our expectations. We love going to the local farmers market on the weekend, hiking, snowshoeing in the winter, and being a part of our local Jewish community. My colleagues here have definitely become my friends, and we can't wait to meet you.
One of my favorite things about Colorado is exploring all the different restaurants in the Denver Aurora area. There are a lot of different places that are owned by minority and refugee families, and even during times of COVID, you can always order takeout.
Coming from the Midwest, I love living in Denver. I find it's a really similar vibe of really friendly and welcoming people, but a lot more sunshine. It's super fun to go to the mountains, go skiing, hiking, but there's also a lot of indoor activities too, if that's not your thing.
One of my favorite things to do outside of work is take my 2 little kids to the Denver Zoo.
So coming from the Southeast, living in Denver is a wonderful place. You have all 4 seasons, and Often you can go into the mountains and experience all 4 seasons any time of the year. You can live all over town. Many of our fellows and other residents live near the hospital, and some live within a 30-minute commute, and all is easy within the city of Denver.
Also, I just really love the folks who are in Denver. People from all over the country move here just to experience a lifestyle, so you get to meet people from all different parts of the country. Lots of people who are looking to build a community, who are away from their families, just kind of exploring the country, and so I really liked making friends here.
So as a first-year fellow, my wife and I had our first son, actually right in the middle of the holidays during Christmas, and I think the fellowship program and my particular program director was really receptive to doing anything that was possible to help facilitate having a baby, the stresses that come with a newborn and a baby who doesn't know how to sleep until they're 5 months old.
I had a baby 3 weeks into fellowship, and I was really nervous, but I did feel like I had really good support, both from my fellowship and from the leadership in general. There's lots of lactation rooms here at the hospital for use, and in general, it's definitely doable to have a baby during fellowship.
Welcome to Colorado!
Big shout out to the fellows.
This is our administrative pavilion. Here you'll find all of our cubicles, radiology, and a place to get your steps in while doing work.
So the concierge desk at the hospital, they provide all kinds of services, including dry cleaning pickup, food pickup, and even run miscellaneous errands like oil changes for your car.
And it's a full functioning post office, which is awesome.
What's going on? This is Cody broadcasting from Seacrest Studios here at B-Boy 45. Just want to let you know, we love our fellows.